Hi everyone, this is Connie. Sorry I can't make it today. So the journal I have is called Core, which is a really good journal, but for the most part, and it's exchanged between the orthopods about really practical matters. So like the best surgical approach for a procedure or how to best use a new piece of hardware. So it's actually pretty useful and practical, but it's not really novel or innovative. So I don't really think any of the articles this year should win the Lodwick, but I picked something which I thought was interesting because of its simple and practical nature. So first off, infection as a complication of hip arthroplasty, it's pretty rare, only about 1.5% of all hip arthroplasties, but it can be really devastating. If the hardware is infected, it has to come out. So here on the left, you can see the hardware is out, and this thing here is actually a spacer, probably an antibiotic impregnated spacer that's been left in place for the femoral head. And even though this was at the time after the arthroplasty had come out, you can see that there's still big periprosthetic abscesses, even though they already cleaned up everything and debrided. And sometimes the hardware comes out and stays out, like in this case. This is called a Girdlestone procedure, and this is actually 10 years after the hardware came out. So, sometimes they never get an arthroplasty put back in. They're actually pretty functional like this, but it's obviously not a great procedure. And sometimes these patients are even on suppressive antibiotics for life. So anyway, onto the paper. Well, some orthodox thought, how can I reduce this infection rate, in a simple way? And they thought of just having their patients clean their skin really well before they came into surgery. So they got them this pack of chlorhexidine wipes. I Googled it, and this is what it looks like. It looks like any other pack of wipes, but they're 2% chlorhexidine. And they give them very specific instructions of how to clean their skin the night before and the morning of the surgery, and then after they showed up, they quizzed them on it to make sure they did it the right way. And they followed about 1,000 patients with this cleaning protocol and almost 3,000 patients as controls for 1 year after their surgery to evaluate for infection. They looked at both superficial and deep infections. They also stratified the group looking for pre-op infection risk, looking at the wound cleanliness and surgery and everything like that. And that's what this graph is on the right. And they found basically that in all risk categories, there was a lower risk of infection by this simple cleaning. So here, these three are the cleaning group, and the other three are the no cleaning group. And definitely, especially in the high risk group, you can see that it's a lot lower. And at the end of the day, the summative amount is that there is a reduction in the infection rate from about 1.6% in the control group to 0.6% in the group that did the cleaning, a relative risk ratio of 2.68. So just to put this in perspective, using that infection rate these infection rates, and also looking at the total number of hip arthroplasties done, this number is from the CDC from 2010. 320,000 is probably more today. But if you look at the numbers, it means about 3,200 fewer infections per year. I think that's pretty remarkable, given that the invention was so inexpensive and simple and easy to do. So, for all your residents and fellows out there, as you rotate through your procedures, or whether you're in diagnostics or interventional, just open your eyes and look around, because you never know. You might notice some very small modification we could make, whether it's how we interpret a study or how we perform a procedure, and it could potentially impact 3,200 people a year, 32,000 people in 10 years, maybe 64,000 people in your career. I mean, the point is, it's a small intervention. It makes a huge impact on a pretty substantial number of people. So, cool paper. All right, thanks everyone. Take care.